here at Mass Bio. Most of you know the format of this, but I just wanted to go over it for anybody that's new to the program. We'll begin with a one-on-one conversation between Bob and our special guest, and that'll be followed by Q&A from the audience. If you do have any questions, please go to the Q&A box at the bottom of the screen and type in your questions, and we'll do our best to get to all of them as time permits. Thanks again for joining, and I'll turn it over to Bob.
Thank you, Susan, and I apologize for jumping the gun there, but as you can tell, I'm so excited about our show here today. We have a wonderful guest, and ladies and gentlemen, welcome to this week's edition of Policymakers Live, which is, as you know, our new series of virtual benefits and briefings that we're holding in the coming weeks and months to come with members from the legislature and the administration. This is the third Policymakers Live event, and you know, I've been really thrilled with how well they've been going. And even though it's not the type of interaction that we're accustomed to, this is a great way to continue the conversations, the in-depth conversations with legislators, and it's certainly helped advance the conversation on a number of topics important to our member companies. You know, I want to thank our sponsors for Policymakers Lives. None of this would be possible without the support of the sponsors of our first series during this month of May. It's Alexion, Amgen, BMS, Pfizer, and Takeda. So thank you so much for helping Mass Bio to continue and advance our mission of making Massachusetts the best place in the world for the life sciences. I am so excited to have our friend, Representative Marjorie Decker with us here today. Please join me in welcoming her. But by way of background, she was elected in 2012 to represent the 25th Middlesex District, which includes many neighborhoods right in our backyard in the city of Cambridge. She served as a member of the Cambridge City Council from 1999 to 2013. Wow, a total of 14 years. She's currently the House Chair of the Joint Committee on Mental Health, Substance Use, and Recovery. And you know something? I am so looking forward to hearing your thoughts, Madam Chair, on how legislating has changed, the House plans for the reset of the session, and your thoughts on how this current pandemic will impact something that you and I have talked a lot about over the last several weeks, is mental health issues moving forward as we pull ourselves out of this crisis. So welcome, Madam Chairman. Thank you for being here with us today. How are you doing?
Bob, I'm doing great, considering how awful this is, right? I mean, you and I have talked, it's hour by hour, day by day, and I'm fortunate right now to have some blessings where I'm not sick and my kids are okay. So really important when we talk about mental health for me, is about making sure every day we do actually tally the blessings that are happening, because ultimately this experience is really brutal on all of us, and brutal on a lot of the people that we care about, and brutal on the people that we're charged with actually helping to support. So thank you for doing this. I want to tell you, when you started talking, one of the things that I love about you is you're infectious yourself. You're always high energy, and even when you're like expressing disappointment and frustration on any given day, it's still coming out in a way that's like really upbeat and passionate. And so I think that's what has served you well, and it's what has served Mass Bio well, and it's what allowed you to quickly pivot to make sure that when it came time to ensure that the state had the PPE that we needed, you were so innovative with your team. And I just want to say thank you. Thank you for all you're doing, and thank you for holding this forum.
Yeah, and thank you. And before I even jumped into my first question, Madam Chair, I wanted to thank you for just your commitment. I've been working with you and the members of your staff. Our entire team at Mass Bio has been working with your entire team on issues such as PPE and making sure that all of the frontline healthcare workers, even in our safety net areas, got our most vulnerable areas, got what they needed. And I got the opportunity to see your true colors as a leader. And that really, really is something that I hope all of the people who work in the life sciences, I wish they all could have gotten a front row seat like I could have, to see how much you care. And as all of us who have served in elected office, there's the most important thing is that you care and love the people that you represent. And I'm getting all mushy here.
I know. I'm thinking we could have this big love fest. It's
Yeah,
'cause
so
we're
let me
both
get
committed
to
public service.
Yes, you're awesome at it, and I'm grateful that you're in the role that you're in, because something that we all care about in this industry, and I personally care a great deal about, is mental health and mental wellness. And the data suggests that this virus has had a legitimate disproportionate impact of illness and death amongst racial and ethnic minority groups. And, you've looked at our commitment to diversity and inclusion and equality. Like, give us some of your thoughts about your district and some of the challenges that the Cambridge neighborhoods have represented.
Yeah, Cambridge is, you're located here, but you also know that it's you're in one of the most changed neighborhoods, and I think that just speaks so well to what Cambridge is. You are seated where some of the multi-billion-dollar companies, right, are housed, doing really incredibly important work. But right across the street are also some of the most under-resourced families in my community who live in public housing. And you have pre-pandemic coffee shops where they couldn't afford to they couldn't afford to waste a cup of coffee, buying a cup of coffee at some of those shops, because that represents actually food on the table. So Cambridge has always been a tale of two cities, and I think exactly where you sit is just the visual of that representation. We know that this virus has disproportionately impacted those who are the most under-resourced, and that is based on zip code, it's based on ethnicity, it's based on immigration status. And while many of us have been hailing the heroes, the essential workers, both at the hospital and the grocery store workers, let's be really clear, the heroes at the grocery stores and those who are delivering foods, they set out to feed their families, not to be heroes. But they have become heroes. But I would say that our response has not been proportionate to their value. And they're the ones who are still suffering, who still have to find ways to make a living when they are not eligible for federal resources because of their immigration status, or even just as unjustly, you could be a citizen, and if you filed for if you filed your taxes jointly with your spouse who was not a citizen but has an ID that allows them to pay taxes, neither one of you received that $1,200 check. So a citizen filed jointly with their non-citizen spouse and did not receive that $1,200 relief check. And so that's the state of where the harm in terms of where we are withholding the meager resources that have been put out there. And now fast forward that to, I live in a community that disproportionately feels the impact based again on who is the most under-resourced. It's a tale of two cities. But I also, as you know, one of my passions has been, and has always been, but has emerged even more so, is supporting our safety net hospital here in Cambridge. And our safety net hospital, what's important for people to remember that while we have the actual building in Cambridge, the Cambridge Hospital, which went on to become the Cambridge Health Alliance, has also took over the Whittemore Hospital in Everett, serves Everett, Chelsea, Malden, and parts of Revere, which have become hotspots in this pandemic. So Chelsea, a pandemic. Brockton, a pandemic. Communities with high numbers of immigrants and Black and brown families have been the hardest hit on this. And so my support and urgency for supporting the Cambridge Health Alliance is understanding early on, as an acute care hospital, we started surging very quickly. And it's because of the numbers both in Cambridge, but also because of Chelsea and who they were serving. And they're not a for-profit hospital. For those who don't know what safety net means, it means that they serve everybody, regardless of their income and their status. And what they've had to do is disproportionate to the amount of resources and support that they get from the federal government.
Yeah, you brought up the Cambridge Health Alliance. A jewel right in our backyard. They were hit harder and quicker and more adversely affected than other places. You spearheaded immediate efforts to try to right the ship there. Tell us a little bit about what made you do that and why you did it and how you got through it, working with CHA and neighbors.
Yeah, I mean, not only am I a patient, I've been a patient there since birth, right? But, remember, when I, as a baby in this community, my family lived in public housing. Actually, I've lived in public housing my whole life until I went on to, to college. And they serve everybody. You cannot get better healthcare, as far as I'm concerned, than at the Cambridge Health Alliance. But who their mission is to support the most under-resourced families. And I work very closely with them and the CEO of the hospital and providers. The providers of that hospital are my friends, are my neighbors. And so we knew how early on they weren't getting enough PPE. They're still not getting enough PPE, but no one's getting enough PPE. Let's continue to blow that myth out, right? Nobody's getting enough PPE. They have less resources than some of the larger for-profit organizations, healthcare organizations. So they quickly were losing out on the opportunity to bid, or even recently, half of the orders that they've put in for gloves, only half came. And so they've been relying on the state, who's doing the best they can. Quickly, early on, what you did, was a game changer. Without PPE, you cannot actually protect people. You can't make them healthy. You can't help them stay healthy. And so what MassBio did is very quickly absolutely benefited the Cambridge Health Alliance and hospitals all over the state. And so my commitment to the Cambridge Health Alliance is, and since then, we've gone on to try to raise money for them privately. And you have been a great champion as well of not only, our safety net hospital, but safety net hospitals around the state. And so we're trying to raise the money because they don't have enough resources, but we cannot afford for them to fail. Because if serving the most underrepresented and the most under-resourced people in our communities, which are low income, working poor, poor people, and immigrants, if you don't understand the response as a human rights response, then it must be a public health response in the middle of an infectious disease that is going to ravage all of us. And if none of us are safe, if all of us aren't safe, none of us are safe. Even as much as some people can live in a bubble of safety, that bubble will burst. So that's really has been my passion and my response is to it's a thread of what my life's career has been about and about where I come from. So thank you.
No, thank you. Thank you for your leadership on that. Let's go back pre-COVID-19. You're chair of such an important committee, okay, mental health. You have always been keenly aware of the need to support programs for those facing mental health issues. I think we're going into a new world now as a result of COVID-19. I think it's safe to say that everybody would agree that a lot of these issues are going to be compounded. I think, in what work that's been done around PTSD as it relates to veterans and whatnot, that's something that I've been involved with. And now to think of what frontline healthcare's workers could be and will be facing, never mind what it's done to people who may not have been seeking help, treatment, care, etc., for existing mental health and wellness. What do you see the future like? Are there things that us and all of the policy folks that are on this call right now that are viewing, what do you think needs to happen? What can we do to help? Because mental health is so important.
Yeah, thank you, Bob. And I would say, so the committee's charge is on mental health and substance use, and substance use disorders and recovery. And so, and some of your members touch in that work in a variety of ways. But, early on, talking to a lot of providers, they talked about their fears of a mental health surge. Not fears, but really a prediction. So in the same way, we quickly were able to organize our medical care and our facilities around responding to the actual physical trauma of having this virus and trying to contain that and help people stay alive. We're also, I think, in that equivalent place that we need to be doing that same work and urgency and understanding that the trauma, the mental health trauma that is already happening. So those in recovery, we're still going to understand those who've actually recovered from this virus, the impact for them on this is still to be determined. What does it mean to be on a ventilator and recover? So what does it mean to have the guilt of maybe having spread this infection to people that you love? The grieving of life that has been lost. It's unfathomable about how many people have been whose lives have been lost to this in our community. And then there's the unemployment and the inability for us to just be able to be connected. Human beings need to connect with each other, right? I can't imagine a world where Bob Coughlin doesn't get to hug people when he sees them, right? And so that aren't family. Right. So, and I think anybody watching this anecdotally sees this in their own lives, sees this with their children. I have young children, and the fact that they can't play physically with other children So, you know, for those of us who have some resources and we look at the trauma of this impact, and those who are already under-resourced, we need to be preparing for this mental health surge that's already emerging. And it's going to be really tough because we know that revenue's down. Last I heard maybe $6 to $7 billion of a deficit. We're still waiting to find out. And so with those kind of devastating losses of revenue, we think about where we can cut. I'm saying we can't afford to cut around our mental health and our behavioral health resources and our programs. And many of those programs have already taken on the cost, burdened the cost of this beyond what their budgets allow them to begin with. We had 5 congregate homes in Cambridge that had to quarantine for 2 weeks, ask staff to quarantine for 2 weeks with them, pay people around the clock because an assistant, because a nursing assistant who had mixed income immigration status in her family and didn't see a path forward to stay home and feed her children was worried about revealing early on that this person didn't feel well. And I'll tell you, if we don't allow people to be safe and feel safe and not worry about their families being ripped apart or getting food onto their plates, then this is what happened. So this nonprofit had to pay everybody around the clock, tripling its budget.
Wow.
and ensuring, and now many of those places, whether it's congregate care homes or whether it's hospitals that do psychiatric inpatient care, the additional cost of PPE testing, new protocols, medical interventions that were never part of their training or staffing to begin with. There's things that the state has done that have been really good. In this state of emergency, we quickly moved to telehealth medicine. The conversations I was having around the state prior to this pandemic was the shortage and the inability for people to access mental health providers who were not available in their districts or their areas. That has essentially been eliminated with telehealth. And so that's going to be an issue where we're going to have the idea that we're going to go backwards after a state of emergency is over. One, I don't know what it looks like to declare the state of emergency over until there's actually a vaccine. That's just my opinion. 2, we're going to have to make sure that people can continue to reach out and connect. I know that you have questions, and I have more that I'll say, so I'll wait, and I'm happy to just answer more of this.
No,
you are absolutely right that there's more to be done, and it's counterintuitive to what our budget is telling us that we need to be, and I'm worried.
Yeah. You know, let's talk more about this because some questions are coming in, and I want to talk about things like daycare as well. So let's not forget about that because, you know, I can get ADD really bad on a Friday, right? So we want to
childcare.
Yeah, we'll get there. But when you look at the issue of mental wellness and people being on their therapies and access to all health services, whether it's, you know, telepsychiatry or even our drugs. Let's talk about access, okay? Improved access to mental health services. Let's think about what's occurred as a result of waivers and executive orders in other words, telepsychiatry reimbursement parity, prior authorization, 90-day auto refills. Is this stuff that we can see as a result of this becoming reality moving forward? Access is huge.
Well, you know, it's a legislative is a deliberative body that will debate these things, but I, as chair, don't see how we go back. We've expanded the scope of services for some people in the mental health field so they could actually, we needed more people on the ground. And so we had to quickly identify who else has the skill set to provide these kinds of services. Those are things that we were debating and still seeing, like maybe, you know, maybe a little bit of it this year, maybe more of it a few years down the road, but there was more debating that needed to happen. What we've seen is quickly we pivoted because we realized it was essential. The telehealth, I'll tell you, we're not having the conversation about access to the degree that we were. If the issue of access is now more about the mechanisms. Do people have access to internet service? Is their connectivity actually predictable? Do they have computers to do this kind of telehealth? Up until 2 weeks ago, the federal government was not actually covering telephonic services. And so that has changed because you know, so now they're covering telephonic for those who don't have video conferencing available. So the issue of access is no longer about provider, but it's actually about like technology. And then I would also say what's been reported back to me across the state from providers, the access has actually increased. People are not missing appointments that they used to once miss. So the obstacles of travel, of distance and availability have all almost dissipated. And so there's new issues around access. And then we're going to have to get into the issues of also reimbursements. What does a reimbursement look like for telehealth versus an in-person? And I'll just say that what we have to recognize is that whether somebody dies of COVID-19 or suicide or overdose, a death, like a life loss, is a life loss, and absolutely exponentially how people struggle in this pandemic in relationship to the isolation and the quarantine and the disconnectivity of each other. We're going to have to really take a hard look at in the same way that we're looking at how to fight this virus for people physically who have it.
Amazing, because if you think about it, I'm pretty proud of the life sciences industry in that, we've always been advocates for chipping in with co-payment assistance. We've always, many of our companies are ensuring that there's no disruption in people receiving their medications during this time. And I'm very proud of that. And I just hope that things that have been very positive in removing cost to the consumer, to the patients, will continue to do so. I've had 2 telemedicine appointments with doctors so far since this has started, and it has worked wonderfully. It's so much easier. It's better. And, I just hope that the payers that are out there will see that this could be a good thing for everybody as well. So we look forward to continuing.
Everyone else sees it, so that's the good news. Everyone else sees it.
There you go.
I think it also improves healthcare.
Yeah, you bet. I couldn't agree more. And again, I don't know if I would have thought that telehealth would have worked as well as it did 3 months ago. I don't know if I was in that mindset. So maybe this is one of the silver linings coming from all of this. It's forced us all to have to do it, and we realize it's a better, more efficient, more cost-effective way to do it. Let's move on to another topic. As we begin to reopen the economy, this is something that I've heard about from our own employees at MassBio. It's something that I've heard from countless of our member companies saying, families with young children, how do they get back to work if they don't have access to childcare? Childcare is something that's so important to get folks back to work. And I just really wanted to hear your thoughts on it. We have talked about it. I know it's something that you care a lot about, and we thank you for that, because this is a big issue.
So, this is where those moments where I'm proud of the work that both Speaker DeLeo and the House and I have as a chair. The collaboration and the joint advocacy we've had with the administration in a lot of areas have been really successful. And then there's areas where it has not been successful. And I would say the reopening is one. As you may know, the House representative on the reopening, the House and the Senate representatives had no voice. We weren't able to ask questions. So our representative was Representative Marjorie. She was not able to ask questions or have any input. She was there to observe. That was baffling for many of us to begin with. The conversations I had with the Lieutenant Governor early on was, help me understand how you don't have somebody from childcare to the construction industry on this opening up advisory. And I was told, don't worry, they're all going to be engaged. And I was like, well, I am worried, and you should have them at the beginning. All of these hard conversations should be having before the opening happens. So I will say that, I give this a complete F. How do you open up an economy without starting with how you're going to deal with the issue of childcare? Nobody should be calling me or you. I've gotten emails from people, a hairdresser in my district who is distraught because she doesn't know how she's going to go back without childcare. And her childcare is not for a small one. So when we talk childcare, we're usually talking up to age 4, 4.5. She has a 10-year-old. How is she going to go back to work? And if she doesn't go back to work, given that the industry was allowed to open up in the first phase, what does that mean for her ability to actually still be able to pay and put food on her table for her child, right? So the choice of leave your child alone and unsafe in a pandemic and go to work and get food on the table. So I'm happy and really proud and thankful to Speaker DeLeo, who brought on Representative Alice Peisch, who is Chair of Education, and Representative Marjorie, who is our representative on the listening representative, and they have been now assigned to work on this issue. So from a House perspective, we are starting to do the work of asking the hard questions and starting to look for the hard answers, because you don't have an economy if you don't have parents who can't be assured that their children are being well taken care of. And I don't think we still know what that means. It's not about just slots, right? So to listen to somebody talk about there's 15,000 slots of childcare. Childcare is not about slots, and any parent knows that you're not just taking your child and dropping them off in a random place outside of your neighborhood, outside of your community, or a place that you have no connection to, and think that your childcare issues have been resolved. So I don't have the answers, but these are the really complicated questions that certainly if any state has the ability to start thinking through this, it's our state, between the scientists, the medical professionals, the early education specialists. We have the right people here, and now we've got to do that work while we're also trying to move through this opening up.
Yeah, and I'm just so you know, at MassBio, none of our employees need to come back and work in the office. It's 100% voluntary, and a lot of the life science companies are doing that. And the very good reasons why I would expect folks not to be able to come back are obviously, you know, if they live with seniors or they have underlying health conditions, but not having access to childcare is right in that same bucket. But I do know that not everybody has that luxury, and we feel for those people that aren't in that situation. But as an industry, if there's anything that we can do to help you with those efforts, it's very, very important. So thank you for your leadership on that. Another quick question. Expanded practice for healthcare providers, pharmacists, et cetera, so that they can administer vaccine when it's accessible. It's a great question. It's something that we're trying to bounce around as an industry. How is it that we can actually position ourselves to access vaccines when they are approved by using new innovative ways to deploy in homes, out in the field? We're not going to be able to expect everyone to come to their doctor to get a vaccine when it's available. So things like that. I don't know if you need to answer that, but I think that's something that we can continue to work on. Let's go to Folger wants to know, other than telemedicine, what other positive learnings and insights will we learn from our experience with COVID?
That's a big question.
You know, if we were to bounce around a discussion, obviously telemedicine's a big one, but you want to know what I've learned from it, and I think what a lot of people have learned from it, and a lot of your colleagues have learned from it, Madam Chair, is that the most important thing right now to our entire world economy is a vaccine. There is only one way we are going to get out of this problem, and it's with science and innovation and new medicine. And I think everybody has an understanding now, Folger, of how, like for me, it was always a CF medicine so that my kid wouldn't die. That's why I love this industry. Now it's almost like everybody knows what it feels like to be waiting for a medicine so that not only that they can be safe, but they can have some sort of a, you know, normalcy to their life again. So, I mean, that's something.
Bob, I would agree with you. I would say the other sort of the underbelly of that is when we don't have a society that allows people to be the healthiest that they possibly can be, where your immigration status, your zip code, and your income directly impact not only you, but the next several generations of your health and well-being. We know that this virus has disproportionately impacted people who have comorbidities, and to say it in plain language, people who have chronic health illnesses and issues, which tend to be disproportionately more people who are low income and under-resourced. And so even the impact of this virus on both sort of what it has done to one's body and immune system, and I'm not a scientist or epidemiologist, but you know, how people's bodies experience that depends on also the chronic illnesses that they bring to this, although we know that healthy people also have been attacked by this virus and have lost the battle. But I think that's the other thing, right? So while, you know, my life's work has been driven by this mission of anti-poverty work, right? That people should be able to fulfill who they are in this world, not by the luck of draw. And we're also seeing that the impact of both keeping oneself safe, successfully fighting off this virus, and having access to the medical help and to the medicines. As you pointed out, we're going to have to make sure when this vaccine happens that it also gets to everybody, and the proportion of who it gets to, the queue should not be starting with those who have the most resources.
Yeah, that's right. And we are putting together a plan. Another comment and a question that I think, and this is great seeing the amount of questions and comments coming in here. Another casualty, and this is from George, another casualty of this pandemic is the dangerously dropping immunization rates for babies and children. This could lead to more outbreaks. We're talking about what could happen in the fall as a result, if it results of a little flare up again with COVID-19. But think of what could happen with traditional immunization and vaccines as it relates to influenza. What is it that we should be doing to prevent this?
So,
Go ahead.
yeah, so this is scary. I was talking to my pediatrician, who's also the medical director for the Cambridge Health Alliance, and they are really concerned, and doctors are going out and doing home visits to make sure that they can either get to patients or bring patients in. People are scared. So part of what we have to do, both I think in the legislature and in partnership with our healthcare systems and our providers, is to create ways that actually make people feel safer. I'll tell you, I just got an email yesterday from another, anti-vaccine person. Prior to the pandemic, I was a strong supporter of legislation. In fact, I was going to drop the bill myself if somebody else hadn't got it to me, that basically, again, enforces vaccines for everybody going into our public school system, right? I don't have any bandwidth for people who want to find a loophole, not a legitimate medical issue, but a loophole to not be part of, the herd. And so this really is going to be an issue, and there are many people who are going to continue to try to fight that and cause disruption, as not only do we have to get vaccines out to people that were keeping us all safe prior to this, but now when the vaccine for this comes out, what we know is, the herd effect is not going to be enough, even with a vaccine for COVID-19, right? It really is going to be a push to ensure that everybody can get this, that takes this vaccine, unless they have a medical issue. And that's part of the social contract, as far as I'm concerned, about what it means to live in society together. And so I think more to be done, and more controversial conversations to be taking place, but it's going to require all of us, from the biomedical community to the healthcare community to policymakers, to be having these conversations now, in light of the fact that child immunizations have already gone down. It is already problematic, and you're right.
Yeah, that's great. And again, I told you how fast time was going to pass during all of this. And believe it or not, we've already utilized our 30 minutes. But what I want to do in closing, you have some closing remarks, but let us know, this is unconventional times for us as governmental affairs folks and people who are always walking the halls of the State House and the Capitol building. Like, we can't do that right now. So what is it that we do? What is it that we can do? What are the best ways for our member companies working in GR to engage with legislators and staff during this time of remote work?
Yeah, I think doing what you're doing is important. I think that what you did early on, and I've said this to a number of different advocacy groups on different issues, is one of the most important ways to continue to be noticed by policymakers is to understand what's in front of us, right? So many of us have been concerned about trying to meet the needs of people in our community, from shelter to food to you name it. So making yourself relevant to the crisis that's at hand. Well, I mean, the biomedical community is already relevant, right? Because you are at the heart of actually what provides hope for many of us. So I think using this opportunity to really educate legislators and their staff about the work that you're doing, the role that you're playing, continue to find out how can you also be more helpful. And I will say that for me as a Cambridge representative, the companies in Cambridge that quickly stepped up to understand that as a good corporate citizen, it meant supporting the hospital that's a mile down the road, a hospital that might actually be providing care to many of their employees if they get sick, or to people that they'll never meet. But and that's true around the state. So talking to legislators, asking them what are the most pressing concerns in their community, and finding a way that might seem unconventional, but to say we're here to support you. And I think what you're doing with this series is really important. The irony of this is I think you're getting more airtime and ability to educate people. So while your members are hearing about what we're doing, you've also come on to forums with the House of Representatives through our working group, and you've brought people on to educate us about the work that your members are doing. And it's really a good time to capture our attention because, as you and I joke, and you're a former legislator, right? I do think that part of the strength of many legislators is that we have probably some undiagnosed form of ADHD. And I say that because I think it's a strength. It actually is, you know, to blow out the notion of what ADHD is, our brains are wired to take in a lot of information and allow us to actually do a good job at pivoting. But it means that we also, as legislators, our time is being pulled in a lot of different directions. You have us in many ways as a captive audience that's hungry for information and probably hungrier for science in a way that has been unheard of, I'd say, you know, maybe forever, and really wanting to be educated, because the more we understand about the work that your members are doing, the better we can actually advocate and inform our own communities about where we need to move forward. So thank you for all of your work, your leadership. Thank you to your members. And again, I'm just saying thank you for the infectiousness of like the joy that you bring. Even when you're pissed, Bob Coughlin, you're still smiling, right? And now you're just like your anxiety and your stress to make sure we're doing everything we can still comes out in a way that provides joy and access. And I don't discount the importance of that.
Thank you so much, Madam Chairman, and thank you for all that you do for patients. There are a few more comments and questions. I can sense the excitement amongst the viewers and the participants in this conversation.
I'm available.
Yeah.
Happy to talk to anyone offline.
Thank you, because this conversation will continue, because people are saying, what is it that how can we help to increase access, mental health, addiction, future vaccines, reduce the stigma.
Marjorie.Decker at mahouse.gov. Email me.
There is no greater champion. So thank you, Madam Chair. And also thank you for being such an amazing friend. Another silver lining for me that's happened as a result of this tragic crisis that we're in is that I've had an unbelievable opportunity to work with you so much, and I really enjoy it. So thank you for that.
Thank you for everything you're doing as well.
All right. Thank you, ladies and gentlemen. Thank you. Again, I want to thank our sponsors for this event: Alexion, Amgen, BMS, Pfizer, and Takeda. I also want to let you know that our future events coming up in June, we're going to have Senator Mike Rodrigues, who is the chair of the Senate Committee on Ways and Means, on June 12th at 11 a.m. Put it on your calendar. We're going to have another member from the Senate side, Senator Eric Lesser, who is the Senate chair on the Joint Committee on Economic Development and Emerging Technologies, and also really focused on the future of manufacturing in Massachusetts. I'm excited to talk about that. And then also we have chair of the Economic Development and Emerging Technology on the House side, the one and only representative, Ann Margaret Ferrante, who's also been a champion to the life sciences industry. She's going to be on June 18th at Ann Margaret she's in June as well. We'll get all of these dates out to you, and I want to thank our sponsors for the June series. It's going to be Novo Nordisk, Synovian, Takeda, and Vertex. So a big thank you to all of them in June. Guys, this Policymakers Live has been unbelievable. Post-COVID-19, we're going to continue to do it because it gives everybody an opportunity to communicate to folks in a very easy way. So have a wonderful weekend, and I wish you all to remain safe and healthy. And again, thank you, Chairwoman Decker. It's been an honor to be here with you today.
Thank you, Bob. And thank you to Susan. Let's keep it real. Thanks for Susan.
Thanks, Susan.
Going.
It's the best.
Happy
Thank you very much.
Have a great weekend.
Okay, take care, folks.